Peace and welcome to Cutting Through the Hype with Mara and Christina. Today we are going to be talking about hormone replacement therapy, and especially as it relates to cancer and some of the risks, some of the things that people thought in the past. And then there was this study that Mara's going to talk about and how it changed. But one of the things that I want to say before we even get into it, first, hi, Mara Zantonia.
Yes.
Mara
Hi.
Zantonia.
Hi, Dr. Parks. How are you today?
And I want to say that this is not medical advice. I'm just sharing some context as a PhD in cellular and molecular biology and biochemistry who's studied food, nutrition, and health recovery for about 30 years on some of these modern topics. And then my friend Mara is just really, really into health. And so we just have these conversations, and someone said, how do you pick up topics? Oh my gosh, like all we have to do is say hi to each other and there's another topic. I mean, she'll be like, and this, and I'm like, but that, and and it just
and
goes
then we're
on
like,
and
wait.
on.
We're like, wait, stop talking. This is a show. We have to share this.
Exactly. And so we want you to be part of our honest conversations. So today we are really going to focus on hormone replacement therapy for today, mostly in women, and this cancer risk, and also just all of the different questions that I didn't actually know. I'll start with myself for just a second and say I almost went this route when my adrenals crashed, when my brother died, my adrenals crashed and my sex hormones tanked. Luckily, with some herbals, I was able to recover. So I actually, almost desperately went that route, but then recovered enough that I didn't actually do all the research. Well, Mara has been researching this more than me. And I do want to say, whether it's the mothers of injured children from the injections, or just people who are really intense on their health, it's the questions that I get primarily from women, sometimes from men, that are researchers that really drive a lot of my focus. And that's been the case with Mara. So I have the context and the foundation to understand things quickly. But that doesn't mean the people who have done the research are always teaching me something new. And so I'm learning from Mara as well. So let's hear a little bit about your journey and what you found in that study and how that framed your thinking.
Okay. So similar to you, I felt like I had managed what I didn't even realize were a collection of perimenopausal symptoms for the last few years. And through herbals, through acupuncture, through fitness and diet and all these good things. And just little by little, it felt like everything was not working. And the sleep was my major and still is my major. I have some improvements. But that for me is the driving force, because I joke that the amount of sleep I need is practically like having a disability. I need sleep, and I am not a nice person when I don't get it.
Can I pop in with a question first? And this is where we have these conversations that I didn't ask you yesterday. So progesterone is really, really associated with sleep. And as you get into these perimenopause and menopause years, when your progesterone goes down relative to your estrogen, your body doesn't handle stress as well. So your cortisol peaks. And that is why a lot of people are up from that 3 to 5 or that 2 to 5. And a lot of times putting on a progesterone cream can help. But I've also heard that oral progesterone can help. So as we know, as we talked about yesterday, estrogen and testosterone are not usually given orally because they can cause liver problems. Estrogen can cause clotting problems. But the oral progesterone cream actually oral progesterone,
Right.
not the cream, don't eat the cream,
Yeah.
is good for sleep. So did you try that?
I have, right. So it's micronized progesterone. It's like oral bioidentical micronized progesterone. That was what I,
and not progestin, right?
Right.
Synthetic, right?
For that specifically. And then again, it's still about dosing, right? So I was started on 100 milligrams, and then this recent consult that I had with a hormone specialist out of Israel bumped that up in his new prescription that I read to 200. So I'm waiting for that prescription to come through the compounding pharmacy in the next day or so. But while I wait, I was like, well, I've got the bottle of progesterone, so I can just up my dose. And yes, It's made a difference.
So you're sleeping better.
And always nuances, right? Love a good Facebook group. So the details that you can get about health issues in Facebook groups is like no other, I swear. And honestly, obviously you have to do it with, you know, your own filters to like make sure you're just like, okay, yeah, that feels right, or I feel comfortable with that, or let me talk to my doctor. I bring a lot of details I get from groups to my doctor. So one of them is that all these women in this HRT chat on a Facebook group are talking about the absorption of the micronized progesterone capsules being so much better if it's taken vaginally or rectally. So
because your mucosa is very, very absorptive compared possibly to your stomach, where you've got the stomach acid that might be breaking it down. Okay, so something that people may not.
Right. So I had never heard that, a year of being on my, you know, original dose. And, you know, I did. So as I ran into this and HRT started coming into my awareness, I did what I always do about any subject that I'm interested in. So, you know, for many, many years, I went deep into studying dog training and specifically dog agility. So you buy books, you watch videos, you take online classes, you go to conferences. I did the same thing with birth. I prepared for 2 home births. So I took an online class. I took a local class. I got all the books. I did all the study. And so as HRT came into my awareness, I'm like, okay, what are the books? Let me grab a couple books. Oh, there's a midlife women's health conference in Las Vegas. So I went to that last April. And for me, like, I'm a very kind of experiential learner. So like actually going and sitting in a room with these presenters, who a lot of them were different specialist physicians, and some, you know, with more like kind of fun topics as well in like midlife women's health issues. It's just so inspiring, right? And I feel like it also just, the more you hear something, like I was able to come home and know exactly what to ask my doctor for, or at least how to start the conversation. Like, okay, so I would like to test my levels in this, this, and this. And then depending on those results, these are this is the HRT that I'm interested in taking. I'm interested in bioidentical, you know, so as you mentioned, the first thing that comes up when you start to look into this is this Women's Health Initiative study that was done like 20 something years ago. And now it's come out that it was a flawed study. So they used synthetic forms of hormones. And I believe.
And of course, estrogens. So they're not human, right? Or synthetic, right? Because those were easier and lower costs to find.
Right. And they started it on an older population already. So the results were skewed. So now the conversation is about symptom relief and women starting to come in and fill those gaps as the hormones drop before you get to that 1% level post menopause. They're saying now, like, if you wait that long, it's not too late, but you missed all those years of the protective benefit. So the philosophy is, as the hormones decline, we have all these hormone receptors all over our body, and for women mainly, like the estrogen being in every single organ system. And so we start to experience this, what basically summarizes as like, you just feel like your body is breaking down, because you get to a certain age, you go to, I think I said this to you, like I go to an eye appointment and it's like, okay, so your eyes look a little bit dry. How many hours a day are you wearing your contacts? And could we reduce that? There's really nothing you can do about it. You can get some eye drops, some moistening eye drops, but it's just very typical for your age. And I'm like,
okay, so I had that.
I like this conversation. And then I go to the dentist and he's like, okay, well, you have an occlusion on one of the sides of your teeth. And I'm like, well, I've never had that before. What's causing that? Well, it's very typical for your age. And I'm thinking, people, I'm not trying to be typical for my age. Right. Don't throw those words at me.
And we share this whole idea of nutritional healing, which I knew you were already doing. So that almost makes it more concerning, right? Because you're like, I'm doing everything. But I went to the dentist. I was only 40 and my teeth felt loose, like literally loose. I've never had a cavity because my mom gave us cod liver oil as children. And I had a lot of sensitivity along the gum line. So then I'm using Sensodyne, which I don't like because I know it's got
Right.
chemicals in it.
Right.
And then, I was studying Weston A. Price. So I got a fermented cod liver oil. Literally within 2 weeks, I lost my tooth sensitivity along the gum line. My teeth started not feel loose. They've never been loose before. And they were told me it's aging. There's nothing you can do. Something as simple, and my seasonal affective disorder went away. I was like, there's sometimes intellectually, but then when that happens, it's like, oh my gosh, I've been lied to like my whole life, told that like there's nothing you can do about this. So that just changed my perspective. And one of the things I want to bring up as you go on with your story is but now we replaced, okay, remember when I was in school, if you had cramps, it was all in your head.
Right.
What, like, that is just like the gaslighting that has happened to women. And so I think there's this pushback against all this gaslighting that has happened to women. But at the same time, when we say that, like, you now just need to replace all your hormones because you're aging and you're going to fall apart unless we reestablish hormone levels of a 30-year-old or whatever it is. Like, what are you saying about God's design? Like, think about how a baby is made and all that intricate divine knowledge. Is there not divine knowledge for us aging? Did God go, you've had a kid, you're worthless now. We don't care if you just crumble into dust, right? No, he's like, for me, I'm like, he wants you to have sex without having to worry about contraception or having a pregnancy.
Yeah, but like then there's that whole like,
but can you have sex?
Yeah, if you don't feel sexy, are you going to be having
or
sex?
Things are not working right.
Right.
And there's no lubrication, there's no elasticity.
Right. Like, whoever taught us about the gynecological symptoms of menopause, which is like, hello, like your parts of your vagina and clitoris like actually disappear if you're not like caring for them properly. Which
that was like I'm like walking down the street going, I'm not ready for that. No. Like, there was one thing that would make me do human hormone replacement.
Right. And that's the thing is like at the baseline, everything that I have read and that I am hearing is that at the very baseline, that topical vaginal estrogen cream is pretty much safe across the board. And you could even take like your 75-year-old grandmother who's having reoccurrent UTIs and you can improve her experience so she doesn't potentially die of sepsis in a nursing home. Like, that's massive. But then even just to say like, from age 50 to whatever, like I'm still young and vibrant and I still want to have like a full life. And
and part of it is even just comfort. But I have to say that I am in the best health I've ever been in my life. And that includes my reproductive health. Now I'm single, so I'm not seeing anybody, but I mean, I had dryness, I had chronic like yeast infections, I had all kinds of problems when I was younger. And I think I'm one of these people like you that I'm really sensitive. I'm like that canary and my body didn't detox well. I didn't have enough lubrication, enough moisture. I have to say that when I restored my cellular health and now I'm on this activated collagen, like that collagen is going to bring, moisture, hydration, tissue. I feel like I'm in the best health of my life.
Yeah.
Right?
And
I just want to say that it's not always like when you're younger, you're better. And when you're older, you're worse. It's also your baseline health. But, and so then it's like, where is this conversation about when is it appropriate? And I think it's a person to person context dependent.
Oh, totally. And I think like that's a blanket statement that we should say at the top of the show for all HRT. Every single person's risk benefit is going to be different because we're all so different, right? We're just different people, different health, different baselines. Our bodies respond differently. Now, I'm someone who didn't experience challenges with vaginal health for my whole life, which great, that's fortunate, but I'm also not really willing to gamble with it going forward. So it's like, if I can do something that is and I'll add in here that the next step is that you take a little bit of that cream and it's also really good for wrinkles.
so then my thing as a molecular biologist, is there any risk, right? So then that's why she's always coming to me. Like, I'm like, okay, that sounds great. But before I would tell anybody, be like, is there any risk? And I don't know that there would be. It's topical, it's on your skin. But that said, let's go back to that Women's Health Initiative and talk about what it showed, why it alarmed people, and like kind of where we're at now.
Right. So, I mean, I think it just was like very alarmist because it was just like, oops, stop. Like, these hormones are increasing women's cancer, but it was flawed.
And which cancers?
So I don't even remember specifically. All I needed
That's so
to
funny.
know, all I needed to know, what was it, like endometrial? Was that?
Generally, it's breast cancer first because there are estrogen receptors on your breast. And so in the breast. That's the first place. And then probably your uterine and endometrial cancers. Okay. This is where, if you don't mind, I'll take a minute and kind of actually add some context to this risk, right? Because now, actually, what are you seeing? Before I go into that, what are you seeing now with social media? Isn't it kind of the opposite? They're saying it's great for everything. Put it on.
The pendulum has totally swung, and I think like that's why we wanted to have this conversation, because anytime you kind of go from, oh my God, no, never, throw it all away, get everybody off of it, to like, everybody should be on this. It is the panacea for everything. So, now it's like, it'll solve anxiety, rage, your mood swings, your gut challenges, your bloating, your constipation, your dry skin, your dry eyes, your dry mouth, the ringing in the ears, heart palpitations, irregular and heavy periods, the brain fog. You walk into a room and you're like, oh, what did I come here for? And then the
they're saying it's decreasing cancer risk even. I mean, I've seen it. I don't know. I haven't looked at the exact studies.
When they're saying like it actually reduces cancer, is that what
that's what I'm hearing on social media. I haven't pulled the actual studies, but there's a mechanism for it. And so that's what I'd like to explain.
So, that's the anti-inflammatory mechanism of just like systemic estrogen. And so as it drops, that's why we get like this whole swollen puff look that I call it. Who wants to be puffy? Oh my God.
So that's with estrogen or without?
No, well, I mean, some people say that their experience with the hormones and the estrogen, kind of like similar to birth control, is they can actually get some water weight and become puffy.
That's what I've heard. Yeah.
And then I think it depends, right? It depends how your body reacts to it, because a lot of women who are like kind of deep into these fluctuations, these crazy fluctuations, are just like going so crazy from these symptoms, and they add those hormones, and then their body just kind of goes, okay, like, and they lose that inflammation and that puff.
As my own hormones, and so I'm going to get into how this works. As my own hormones started to fluctuate, I became I'm very sensitive to my body. And so I would know like, oh, I ovulated this month, or like, oh, my estrogen is high, because I would go from having pain and inflammation to suddenly being able to sleep through the night because I didn't have any pain. And I'm like, it's estrogen. So estrogen makes you feel great. And like when you're ovulating, you feel great. Your libido is up. You're sending pheromones that attract, they've actually done studies that show you're more likely to have one night stand when you're ovulating. Okay. God's like, have a kid. So watch out if you're feeling great, like watch out. And the men are more attracted to you. So estrogen, it's better. You can fast easier. You can get up and want to go run. And so I've sort of tracked, but here's the thing. I believe that as we age, so that estrogen is supposed to switch from primarily ovarian to your adrenal glands are supposed to make certain types of estrogens, and your fat can make it. So sometimes your body wants to hold on to fat because your adrenals are shot. So like, I can't make any estrogen because your cortisol is high. Your life is too stressful. But your body wants to switch how the estrogen is made from being primarily from your ovaries to other tissues. So here's the thing. Here's why we say everyone has risk. Many people, like I had the worst endometriosis my fertility specialist had ever seen. Right? He's a fertility specialist. He said my ovaries were the size of softballs. They were filled with endometrial tissue. The endometrial tissue was growing on my intestines and everything. So I ended up, this is before I had any answers, on, birth control pills for 10 years, even though I was against them because I didn't know what else to do. now we know that that endometrial tissue actually is activated by immune dysregulation. So this can be from endocrine disruptors, from the plastics and the nail polish and the eyelash glue, and all of
Right.
those things that get in there and disrupt it. But once that immune dysregulation starts causing that endometrial tissue to grow or the fibroid tissue to grow, and it can happen in your breast tissue and it can happen in your uterine tissue, your ovarian tissue, all of these reproductive tissues,
Right.
then estrogen drives its growth, but it starts with an aberration. And so, like, my whole thing is, well, we need to make sure that we are teaching our young people, we are actually addressing health issues at the root cause. But if you have any of that tissue and you may or may not know if you have it, estrogen replacement therapy could possibly drive its growth. That's why they put me on birth control pills. It was, a low estrogen pill and a high progesterone pill to
Right.
prevent that from keeping growing until I hit menopause. And when I was close enough to menopause, I went off of them to try to regulate my own hormones. So that is where the cancer risk comes from, is the growth most likely of these aberrant tissues that are there because of some inherent dysfunction. But a lot of times we're like, well, I'm already there now. I've already got endometrial tissue. Once it's
Right.
there, it's very hard to always walk it back.
So for women considering going on HRT, like, are there any symptoms, like a symptomology that they could look for within their own body to know whether they have endometriosis?
Well, a lot of
Like,
times you can,
right.
go to your gynecologist. Like, I went to a fertility specialist and they will do an ultrasound to look for fibroids and for endometrial tissue and those sorts of things.
But
So
what
there
what are the symptoms that that would cause a woman
yeah.
to go to the doctor and
So,
say,
I
I feel
think
like I
this is
have this?
right. I think this is really important because, like, that's why I actually didn't have very many symptoms till I was in my 40s, right? But my
And
daughter
really,
came
like,
home.
until you started to get like trying to get pregnant, you didn't really
I would
realize.
already been trying to get pregnant for a long
Okay.
time. Yeah.
Okay.
And so it was because of that it was already because of that I actually was doing all this testing, because I was not fertile. So, but like my daughter came home, painful periods, heavy periods. And this is where I started to talk about this. I had a friend people come to me with their health questions all the time. And
Right.
she's like, I'm having really heavy periods and I'm having a lot of pain and it's increasing like every month. It just seems to get worse. And I'm thinking, okay, this is the beginning of endometriosis. And she was very young. And so I thought, you don't want this to get worse, right? So I started asking her questions because I'm thinking first, I'm like, your nails, endocrine disruptor, your eyelash glue, endocrine disruptor. But
Mhm.
I'm like, it's probably something else. And then just in an off thing, women share, she was saying she was using minoxidil, Rogaine, for her hair. And she loved what it was doing for her eyelashes, eyelash growth, and for her hair growth, right? So this vanity thing. And I just thought, I'm always curious. I'm like, what is that? When I looked up minoxidil, it said it's not a hormone. It's not a hormone. And so you don't have to worry about it disrupting your hormones. And when I looked into the molecular biochemical mechanism, they lied. It itself is not a hormone. And they didn't know how it worked. And they admitted they didn't know how it worked. Isn't that great? It's like
How
literally.
did they get away with that?
Yeah.
Like, just straight up lying.
And when I looked into it, the molecular mechanism is it gets your hair cells, wherever you put it on, whatever skin you put it on, to actually produce estrogen. Right? So if you're a guy, and she was taking the Rogaine for men because it's more concentrated. For a guy, you're feminizing your scalp in order to try to grow hair. And this is where, like, I didn't realize, like, I'm learning along with everybody else. When I was on those low dose estrogens, higher progesterone for years, my hair stopped growing. And I don't know, you're just getting old, right? Again, or whatever. And then I went into menopause. So I've had like 20 years of suboptimal hair growth. And I'm like, dang it, but estrogen is what helps your hair get long. And so this minoxidil is causing your skin cells, your hair cells, to produce more estrogen, whether it's in men or in women. It doesn't stay in those cells. It goes all throughout the body. So most likely in her, it was actually traveling and causing these endometrial symptoms. It was driving these heavy periods. And so she went off of it and her cycle started regulating, less pain, less heavy periods, and those sorts of things. So you don't always have symptoms, but those are some of the most likely symptoms. Extreme breast tenderness and engorgement, all of those would be symptoms of estrogen dominance that could lead to endometriosis or whatever.
Okay. And so I guess if someone had concerns before going on HRT, they could ask their doctor for an ultrasound to look for endometriosis.
Right. And then they could track it like every few
Right.
months and see
Right.
On which dose. And, because if you are in menopause or perimenopausal, if your levels are low enough, it may not be driving that. I'm not an expert in this at all. I just want you to understand the mechanism. And some people have a history of estrogen-driven breast cancer in their family, or they have these tumor suppressor genes that are mutated, so that if they have any estrogen receptors, it's going to be kind of fuel on the fire. They're going to have many different risk factors, right?
Right. And maybe now is a good place to go back and talk about a baseline health and how, like, I didn't reach for the HRT as a first line of defense. I, made sure that I had that baseline of health. I feel like so much better just with all of the things that I'm willing to experiment with, being HRT, peptides, anything else, just being on the NRF1, the NRF2, and the activated collagen, because I just feel like that gives me a base that's like really strong. For the way that you explain the NRF2 and how it opens up the detox pathways, like, to me, it makes me feel so much better about adding anything else into my body, because I'm kind of like, I just know that at least everything is working properly. So it's not going to get all stuck and like gummed up in my system.
Yeah. So here's the thing, and this is to your point. One of the things that I think people are doing, now, is they're using estrogen for its anti-inflammatory benefits. And if there is a reduction in cancer risk, it's because I believe inflammation really, really drives cancer.
Right.
And,
so it could be like not to interrupt you, but the same concept of like eliminating sugar from your diet. It's like,
right. Yes, exactly. Instead,
right?
we're just going to go on estrogen because it is so anti-inflammatory. It's like an easy win, right? Just add some estrogen and you'll feel better. But what it could be masking is the fact that you have too many seed oils, too many omega-6s, that you have too much sugar in your diet.
Right.
So
and that's all the stuff like we talk about back to the foundation of like, I made sure that was locked down first. Right. My kids even tell me, they'll be like, oh, they'll have a treat. They'll be like eating French fries, and they're like, "Oh, Mom, the seed oil is so good." Just to put it in my face.
You're like, wait till tomorrow when you're achy. Yeah, they're young enough. That's probably not an issue.
But they're
aware. They're aware of it.
They're aware from a very young age, because we always say we don't eat seed oil, or we minimize our consumption as much as possible. Same with sugar. We're always looking for those better choices, right? The probiotic sodas or the kombucha. Using raw honey and maple syrup. And my husband loves to bake. Bless him. He's an amazing baker, but he's not really into substitutes. He's like, no, he'll use all organic, but he wants the King Arthur organic flour, and he wants
but he's still going to make
cane sugar, but it'll be best of class, but still but anyway, just to say that rolls in to the baseline of health. It's not like I'm saying I'm going to take this HRT to mask all these bad habits that I have. I was saying
and some people don't know that they have the bad habits. So this is where someone had a question about the activated collagen that you mentioned, and it really goes directly to what we're talking about in terms of endometriosis. So one of the things that, again, they're now finding, however many years later, is that the beginning cells that start the endometriosis, it starts from immune dysfunction. Right? Like we all have autoimmune issues or whatever. And a lot of that is coming from like endocrine disruptors, all the chemicals we're exposed to, whatever it is. Like we don't even know half the time what we've been exposed to, right? So I'm not going to blame people. But And so it's that immune disruption that starts those cells growing. One of the reasons our NRF2 turns on the body's antioxidant detox pathway, and we have an activated collagen. And amazingly enough, we're filing for a patent. This is the company that I'm a consultant for our activated collagen, because the two of them together actually bring the immune system away from that kind of dysregulation that nucleates these aberrant cells and helps to bring the immune system back into balance. And so an activated collagen is one that actually activates your body's own natural collagen production, reduces inflammation. It's basically activating your genes to get back to doing what they should be doing, as opposed to just, listening to all of the endocrine disruptors you have in your system.
Right. And I'm coming up, we've mentioned it before. I mean, I'm coming up on my 4-year anniversary, I believe, to my hernia surgery, which is what prompted me to get on the products. And, in the interest of full disclosure, you became a consultant, you introduced me to them. I became a consultant really just for the discount. I mean, I love working with you on it because I just get to sit in on informational calls. And I always say to you, I love that you're not salesy and you're not saying go sell these products, whatever. I just share them with friends. What are you doing? What are you taking? Why does your hair look good? Why does your skin look good? And I'm I'll share it with you. I'm not trying to sell this, but if you want to try it, sort of a thing.
Well, and I need people to know what's the real thing, because every day, it's is it a new nicotine patch, or is it a life wave stem cell thing? And that's one of the reasons we have this show. Let's look at these things one thing at a time.
Mm-hmm.
But and then we're both guinea pigs, right? I've been on it 6 years. You've been on it 5 years or whatever, 4 years. And so, but one of the things I like is to walk back. When you are rebalancing the immune system, you are reducing your overall risk for, every kind of cancer, because it's the immune system being out of balance that increases inflammation, along with seed oils, endocrine disruptors. And if you turn on your body's natural antioxidant detox pathways, that makes a huge difference too. And we'll make sure the link to those are in the show notes as well.
Right.
But again, that foundation is huge. And for me, that alone with some herbs are extremely adaptogenic. So those made huge difference in my health, but it wasn't enough. I was still having this kind of weird hot flash. But I believe a lot of these hot flashes and different things is mitochondrial health. And we did an episode on that 2 weeks ago, right? That your mitochondria are shot. And I also believe that, things get out of balance, and herbs can be extremely balancing. Oh, I think it's a metabolic issue, right?
Yeah. So those are kind of the blanket statements now are just basically that if you optimize your hormone levels, that you can avoid this decline into metabolic disease, this massive change in your cholesterol levels without a diet change. It's like this feeling that you're losing control of your body and your health. And the Kool-Aid that I have drunk is that it's because the estrogen has gone down the drain. And so I'm looking at it just in this conversation of how do you do the risk benefit analysis of obviously my initial risk benefit analysis is just that while I'm in this peri and I'm struggling with sleeping, it feels very worth it to me. I'm willing, I want to balance and optimize those levels and see what benefits I can get, what disease states I can prevent, because I don't want to be going to the dentist and I'm not having root canal. No, I'm not. And I'm not going to get addicted to some hardcore eye drops for the rest of my life.
No. So you're it's going to prevent you from being on medications. And you said you just went to an HRT doctor and you were one of the only people that wasn't on a bunch of medications. And he was like, what? That's crazy. So I want to touch base with a couple of things. One, yes, you need to. So if you're not sleeping, one of the things that I was going to put in our description is we want everyone to be able to have the resources to meet the day, to actually enjoy your life. So I think all of us, if we're not sleeping or we have some extreme symptoms, there's a time to be okay, I need to do something now so I can function. But
and I'm also not one to reach for a sleeping aid, because that doesn't feel good either.
Oh, no.
So I've tried the magnesium cocktails and they do help, right? For a time they might help. But
Right. And you're trying to reduce, but the thing is, you're trying to do all the things. So
Right.
while you're trying to do all the things, still, you haven't stopped.
Right.
You're like, let me add this. And,
And just
and
see.
I'm just like the next person. If I can't sleep and I have some progesterone cream on the counter, I'm like I'm going through all of things. I took the magnesium. I took, okay,
Right.
well, like now we're doing the progesterone cream. I need to have the resources to meet the day.
Right. And I even tried the wild yam cream. So first,
Right.
I did all
And
the
some of that's
natural
enough
stuff.
for some people.
Right. For some people. Exactly.
But
Exactly.
I found that herbs are extremely adaptogenic, and they actually work with your microbiome to help you not to recycle too much estrogen, to have the right balance. And so I had the LifeVantage products on board, and that helped immensely, but it wasn't enough for specifically the hormonal issues and fluctuations. And so, but when I add herbs on board, then I feel like I'm in that zone where I'm doing really well. But that could change. And the thing is, we don't address root cause enough. So we're in this place where we don't have all the natural solutions quite on board yet, right? But we still have these symptoms. And so we're kind of in this middle space where I think that we're just trying to give people information. And I'm just like, yes, if you're going to do this, don't ignore all these underlying things. And when they tell you that it's going to decrease your risk of cancer, most likely what they mean is it's going to decrease inflammation. And we know that inflammation drives cancer. And so instead of letting estrogen be your anti-inflammatory, maybe you should take out seed oils. Maybe you should take out sugar. Maybe you need to look at some of these other things. Maybe you have a subclinical viral infection, right? That might be driving inflammation in your body, so that because you might end up needing higher levels of estrogen than you might want to continue masking that inflammation. Right. And so the idea is to do as much as you can on your own to rebuild health, because I feel the healthiest I've ever felt, and really strengthening your adrenals, which are going to produce those hormones. I feel like my adrenals are really so much stronger than they were even all through my 40s. And then knowing that if you do gain a little weight, your fat is trying to make some estrogen for you. So don't hate on it. Just be like, okay, how can we keep tweaking this instead of
But it is a different form, right? So it's not the estradiol, it's the estrone, is my understanding. And it's like a less effective form of estrogen. It's going to help with all these issues. So I'm like, yeah, give me my estradiol.
Well, and I'm like, if God made it to switch over, is that some inherent,
right?
And that's where I go to the signaling, and I haven't done it with those specifically. But some of the plant polyphenols do have very mild estrogen-like effects. With actually, they also decrease cancer risk. So they not only increase cancer risk, they decrease it, and they decrease. A lot of times, you will convert testosterone to estrogen in your body. You have something called aromatase, and endocrine disruptors increase that. And the herbals will actually stop that process so that you will keep more of your own estrogen, right? And
so are you also saying, as far as the plant sources, that it can be okay to eat some fermented soy, to eat some organic tofu, knowing that those are soy?
I'm absolutely against soy. So thank you for asking that question.
Yeah, I was curious.
By plant polyphenols, I meant mostly herbs. Bladderwrack is good for estrogen dominance. I've seen some studies on that, but don't go hog wild, right? But there are herbal blends for menopause, so you can look those up or work with a natural practitioner.
I just wanted to be clear about that.
Yeah. And even herbs like, basil, rosemary, a lot of these are adaptogenic. And, we all know turmeric is anti-inflammatory. So these polyphenols, and along the line of those polyphenols, another thing that's kind of, we need to talk about is that cholesterol is the molecule that your body uses to synthesize vitamin D and all your sex hormones. So if you're on statins, you are absolutely destroying the bank with which your body is making all of these different sex hormones,
right. But then it's like this fine line, because as women get older and older and their cholesterol's creeping, that's what doctors want to do, is they want to put them on a statin and cap that.
There's no fine line, because there is actually
no. What I meant was, say you go on the HRT and then you don't have that creep of your cholesterol or that sudden jump. Like I tell my doctor when he looks at my lab results, which I shared with you just because, I always want to loop you in and when you're willing and get your opinion. I mean, my labs looked pretty clean. I think they looked good. And he made some comment about like the LDL being high and, already having come through the Weston Price understanding of like the Framingham heart study where it was, misunderstood, cholesterol was misunderstood and it's been, demonized unnecessarily, that it really doesn't matter. It's like about the ratio. So I just turn to my doctor and I say like, listen, I'm a pro-fat person. Like if it's a healthy fat, I eat it. I'll eat the spoon of coconut oil. I will eat the pat of butter on my bread. In my opinion, healthy fat is good.
So I do want to stay here, and I do have on my Vita website that I have one on endocrine disruptors specifically, and I have a whole thing on fats and on cholesterol specifically, and I may put a link to one on cholesterol in the notes so that you can watch.
I mean, I think that's why so many women, as they're getting like 70s and 80s, are seeing a decline in brain health.
Yes,
is that this generation have starved themselves of fat. They were the generation of margarine, of non-fat yogurt, skim milk.
Yes, non-fat. I won't take anything that's non-fat.
I will not either. I know friends who are like, oh, well, just to balance my macros, I put non-fat yogurt in my shake. And I'm like, that's not normal. Like, just eat it with the fat. Just eat a smaller amount with the fat. The fat is not the enemy. It's not your enemy.
Right. And it helps you absorb your fat-soluble vitamins. So it's very important for that. But I want to make it clear that in studies, they showed that higher cholesterol is actually associated with lower mortality in older people, right? You need cholesterol to make testosterone. So, and so there's this like very narrow window that if you have systemic inflammation leads to cholesterol increases, right? So yeah, the solution is to decrease your inflammation. And then your body won't make as much cholesterol because it's making this cholesterol to try to mop up all of the problems and have enough precursors to make more cortisol to reduce your inflammation. So it's actually homocysteine. And they knew this when I was in graduate school, like 30 years ago, that homocysteine is actually the marker for heart disease, not cholesterol. But since they're selling all these statins and they're selling all these cholesterol meds, they don't want you to know that. So cholesterol isn't actually the marker unless you've already had one or two heart attacks, then it is somewhat correlated with more of a chance. For everybody else, it's not really a very strong correlation. It's really homocysteine. The correlation is that cholesterol is telling you you're inflamed.
Right.
And so how do you reduce the inflammation? So, but if you don't have cholesterol, if you're on a statin, how do you make any sex hormones? And you're actually preventing your heart from, doing what it needs to do, and you're really, really damaging your mitochondrial health. But that's a whole nother episode. But I do want people to know there are resources on Vita for that. And since I'm right there, I'm going to plug. I have some upcoming things on Vita. You can join for just $12.95 a month. I have one that's now on there. Key elements of recovering from chronic illness and vaccine injury is there. And there's tons of different webinars on there once you become a member. But on June 9th, I'm going to do an honest look at creatine. And it's been so fascinating for me learning about this. So I think that's going to be really of interest. I'm totally nerding out on it. And then we're going to talk about some GLP-1 analogs because there's so many generations. There's the Wegovy and semaglutide, and now there's retatrutide. How are they working? What do you need to know? I mean, that's just a whole topic into itself. So go ahead and join. You support me looking into all of these things to get you the information you need to make good health choices. And then you can come on here and we can cut through the hype about it.
Sounds good.
So was there anything we want to wrap this up with? I can't even remember. I'm sure we'll just we'll ponder it. And then next week we'll be like, okay, where do we go from
right.
here?
We'll have another offshoot of a topic on HRT at some point going forward, but feel free to leave comments when you watch the video. If there's anything you want us to hear us chat about, we are open to your ideas.
Yeah, we never even got into, I wanted to talk about the difference between the different forms. Mostly it's injected, but you were talking about maybe a lozenge is a new way of
Oh,
doing it. But we can
yeah,
talk about that next
administration. Yeah,
time.
we'll have to get to that. And actually, it'll be good timing because I'm gonna pick up my new lozenge called a troche from the pharmacy. I'm hoping it's ready tomorrow. So the doctor felt that that is a much more effective absorption, like through the mucosal lining, and it bypasses digestion. And obviously, I had never felt like topical was very effective because it's like, just, I'm not a scientist, from a common sense perspective,
Yeah,
it's
your
like,
skin is thick.
I'm like, yeah, but also it's like, I get out of the shower. How hot and humid is it that day? How much am I sweating? What clothes
Right.
do I put on? What part of my body does the clothes rub on? Because you're kind of changing the spot of like
Yeah.
where you put it. And then like, how soon after am I in the gym and sweating it all out anyway? So it's just, it blows my mind. Like the
The
pharmacist
whole
wanted to
dosing issue, right?
yeah, she just wanted to have a conversation about, no, that's a perfectly acceptable mode of administration. I said, really? Have you considered these factors? And she goes, oh, yeah, I guess there are a lot of factors.
Mm-hmm.
And
All
I'm
right.
just like, okay.
Well, we'll wrap this up. We are probably going to be talking about some of this hormone replacement because there's so many different aspects of the topic for a couple of weeks, unless we, I don't know.
Well, we can always come back to it once I've,
Yeah.
been
So,
on my new form of administration, and then I can report back on
right.
changes and how I'm feeling, and I'll do lab testing again
Exactly.
after.
We actually got a lot covered.
We did. I thought it was good.
All right. Well, thanks for joining us, you guys. Every Tuesday at noon. We'd love to have you here, and we'll talk to you soon. Bye-bye.
Bye.